Winter is far from over. It's likely we will have plenty more days to work or play in the snow and cold. This morning, how to make it through the rest of the season without getting hurt. Dr. Adam Yanke is a sports medicine doctor with Midwest Orthopaedics at Rush. He has simple steps to avoid injuries that will last long past winter. Adam, good morning to you.
Good morning.
Do you see a lot of injuries right about now?
For sure. You know, we'll talk about some specifics, but a lot of this is related to the ice and the weather here in Chicago, obviously, and a lot of it's related to falling. So we see a lot of upper extremity injuries because people try to brace themselves and catch themselves, and so you can have anything from wrist to shoulder injuries at that point.
So one cause right here is snow shoveling. What's happening here?
Yeah, there's two parts to snow shoveling. One is an aerobic part because it's really a type of workout, and the other aspect is musculoskeletal, so your joints and your muscles and your low back in particular. With regard to the aerobic workout, a lot of people that are snow shoveling may not work out in the summer. So they get out there, they try to pick up this heavy, wet snow, which is called heart attack snow, and they can get chest pain, pressure in the chest, sharp radiating pain that can come up to the neck, or even nausea or vomiting. There's signs that you could be having a heart attack. So these are things to look out for.
So before you go out and shovel snow, what are some of the things that you need to keep in mind?
You know, good technique helps a lot, and so you don't want to get out there when the snow is already heavy and wet. You want to get out there early and often, and so you're doing little bits at a time. If you can put some ice down before the snow starts falling or just when it starts falling, you can try to prevent that layer of ice on the bottom that can kind of catch you and cause shoulder problems.
I'm always surprised as I'm driving or, riding down Lakeshore Drive, I see people out running, and it could be 5, 10, 15 degrees outside. It's something that people do normally. So if you are going to be out and you're running in below freezing temperatures, what are some of the things you need to know?
Yeah, we treat a lot of runners, and you either run or you don't run, and people that run, you can't stop. So you might as well make them safe. And so there's different equipment that we have here that we can talk about. And so some of this is these shoes here that have this special tread on the bottom. These can help give you traction if you're running on a snowpack or anything that has some ice involved in it. The next thing is preventing cold injuries, so hypothermia and frostbite. Hypothermia is when your core body temperature starts to decrease, and then it tries to maintain that. And so that's actually why we start to shiver, because it generates body heat. If that gets low enough that you actually stop shivering or you have any confusion at all or poor judgment, then you really should be seeking medical attention at that point.
You mentioned that people will still run in those sub-freezing temperatures. Is it safe? And I mean, especially when we get down below zero.
That's really the key, and that's the cutoff. So when it's below zero, you should really try to spend only as minimal time as you need to be outside, 30 minutes at the most. And if it's the regular temperature is below zero, you probably shouldn't be out at all. And if the wind chill is something like -20, which we've seen relatively frequently, luckily not now, but you probably shouldn't be outside at all.
We talked about it before, but a good note to mention here, what are the signs of hypothermia?
So hypothermia is the shaking that we talked about, and if the trembling gets so bad that you can't even carry a conversation and talk, then that's pretty severe at that point, so you really need to be concerned.
Got it. And a lot of folks, of course, right around this time of year, they go out and they do some skiing and some snowboarding. Some tips to avoid injuries here, what would that be?
Yeah, so let's start top to bottom, and really, you see here that we have these wrist guards, and so that's very important, especially when you're starting out early and maybe you're not the best snowboarder ever. It really prevents any injuries if you try to fall with your arms out extended.
Yeah.
Really, that's not good technique. How you want to fall is in a tucked position and try to roll as much as possible, and that way you decrease the chance of having any wrist injuries.
Is that probably the most common injury that you see when people fall?
For sure. Again, upper extremity is very common with snowboarding, whereas with skiing it's more knee related, and ACL is what's the most common. And then the helmet goes without saying for either skiing or snowboarding. It needs to fit well. It needs to not be loose at all. It helps keep you warm also, and luckily it's becoming pretty common.
All right. Dr. Adam Yanke here to fill us in. Ben, very nicely done. The silent working type we've got here. Thank you so much, bud. Appreciate it. Nicely done, guys. We've got you covered with a lot of the advice that you need. You can read all of it on our website and find a link to more safety information. That's all at ABC7Chicago.com.